Hand me the world on a silver platter.
All right, a very pleasant and good afternoon, everybody. It is 2:33 Eastern Time, and we are joined now by the Commissioner of Health in the volunteer state of Tennessee, Dr. Lisa Piercy. Doctor, good afternoon. All right, and I want to note to my crew back there, I am not hearing Dr. Piercy here in the studio, so we'll fix that right now. Doctor, are you there?
I am here.
There we go. There we go. Well, Dr. Piercy, thank you so much for joining us. We really appreciate it.
Thanks for having me. I'm glad to be here because it's an exciting topic we're going to be talking about.
Well, and I tell you, I told you before we came on, when people found out you would be joining us today, we've gotten a lot of feedback and a lot of, like you say, a lot of excitement. So let me just begin. Over the last 9 months, Doctor, we've seen in the news that each state has had their own particular set of challenges related to the spread of the virus, and now the vaccine rollout. And from your perspective, as a longtime healthcare professional and statewide health official, what have those challenges been here in the state, and what are we doing about it going forward?
Sure. Did you tell me I have about 3 hours to talk today? Because that's about how much I'll need, but I'll try to condense it down for you. So, you know, we've done a lot of things right, and there are a lot of things that have distinguished Tennessee from the rest of the nation, and we're proud of those things. Things like being early to offer widespread and unrestricted testing. One of the things that I think has been one of the most impactful things that we've done that people tend to forget about is we really got out there early on our long-term care population. And the efforts that we made there, not only with testing, but also with some difficult but important decisions we had to make related to visitation, have really protected our most vulnerable folks. And to this day, our death rate in long-term care facilities is substantially lower than that of the nation. You know, the nation has about a 40% average of all of their deaths coming from long-term care. In Tennessee, ours is around 26%. That means we have grandmothers and aunts and fathers and brothers in nursing homes that have survived that probably would not have survived in other states. So those are big wins that we have that we've realized up until now. Another thing that's sort of a hot topic in the news today is we were pretty adamant that it was safe to go back to school, and it has been safe to go back to school, and we know the consequences of not getting in school, and are obviously right this very moment in special session with our legislature to try to mitigate those downsides of kids being out of school. But you know, there are some things that we've struggled with here in Tennessee, and you know, we're a fiercely independent state that places a high value on personal liberty. There's nothing wrong with that. But what that has caused is our mask wearing in Tennessee has been lower than in some other states. And while we'll probably never have a one-to-one causation there, we do know that that has caused our rates to be higher than other states. Our transmission has been higher. And if you have higher transmission, just by the numbers, you're going to have higher hospitalizations and higher death rates. And so that's been one of the things that's been difficult. You know, we've taken the approach all along that we do not believe a one-size-fits-all approach would work in Tennessee. We don't want to do it that way. And so we've been very resistant to issuing a statewide mandate, but rather encouraging people. And a lot of people did. And it helped. But particularly in the months of November and December, we saw unprecedented surging in our cases, which resulted in unnecessary hospitalization and death. The good news is that to round all of this out, we have been and continue to be one of the leading states in the nation on vaccine deployment. Now, I'll be the first to tell you the supply is really, really a lot lower than I would like. I don't have any control over that. But what I do have control over is how quickly the vaccines get deployed when they are delivered. And we have taken the mentality that we're not going to sit on any dose we are going to give it as soon as it arrives in the state. We have already vaccinated 330,000 Tennesseans, and we're well on our way to getting this behind us.
And that, we're joined by Dr. Lisa Piercy. She is the Commissioner of Health in Tennessee, and we're so grateful for her time. Now, Doctor, you quoted the number, and I was just about to go there from the state's COVID dashboard here, the vaccine dashboard. So 330,000 have been vaccinated. And this is just a simple question from a simple person, me. 523,000 have been delivered to Tennessee. Let's talk about the discrepancy in those numbers and why that is.
Sure. So that's a great question because it might be hard to reconcile what I just said as being one of the top states in deployment and saying, well, where's the other 50%? What you have to remember is that for the month of January, about 40% of our supply had to be skimmed off the top to give to the long-term care partnership. In Tennessee, as with the rest of the nation, the majority of long-term care facilities are being covered through the federal CVS and Walgreens partnership. In Tennessee, that's about 90%, the other 10% being covered by independent pharmacies. So when we get a delivery in, we have to skim off the top and give it to them so they can administer those in long-term care. They've been doing a good job at doing that. We have about 75 or 80% of our facilities that were done by the end of last week, and the remaining 25% of nursing homes are scheduled to be done by the end of this week, and then the assisted living care facilities get started. So when you account for that almost 40% being skimmed off the top, and then you put it on top of what has already been delivered, you get much closer to full deployment.
Thank you. We're joined by Dr. Lisa Piercy, the Commissioner of Health in Tennessee. And you talked about, as far as we're not getting as much as you would like, we're probably not getting as much as anybody would like at this point in the volunteer state. So here's the question. When will we get more vaccine, and how often do we get it in this state?
Yeah, that's a great question, and one that I wish I had a better answer to. We receive vaccine on a weekly basis, and we've been told for the month of January to expect plus or minus 80,000 doses a week. We were initially told 90, that panned out to be about 80. I think last week we got 79,000. Next week we're slated to get 83,000. So it's right around that 80,000 mark. And when you do that math, that puts us months and months and months away from having all Tennesseans vaccinated. However, we have been told by Operation Warp Speed that beginning the last week of the month, which is next week, we will start to see increasing allocations week over week through the months of February and March. So what I don't know is that a 5% increase? Is that a 45% increase? I don't know yet. I just know that I am really waiting until next Tuesday when that ordering portal opens up so I can see how much I can order. I want to reassure you and your listeners that we are ordering the maximum amount every time that portal comes open, which is usually on Tuesday nights. We max it out and then deploy whatever they send to us.
President-elect Biden has suggested that, you mentioned Operation Warp Speed, he has suggested he wants to release all of the vaccine, not hold any back for second shots. Where do you stand on that?
Well, unfortunately, I don't think there's much of a reserve to be released. There was the initial statement that he was going to release second doses. And I think as his administration and his transition team has worked through the logistics, turns out I think most of those have already been deployed. So for a brief moment there, I thought I was going to get an extra 300,000 or 400,000 doses in one large shipment or in a couple of large shipments. Turns out I don't think I'm going to get that. So we're just sort of holding our breaths to see what our weekly allocation is going to be.
We're joined by Dr. Lisa Piercy, the State Commissioner of Health, here on Mix 104.1. Let me move to another issue, and that is we're hearing a lot about variants, even this morning, virus variants. One report out west in California says that this virus, another variant of this virus, is resistant to the vaccines that we have and have been approved in the United States. What do you make of the variants, and have we seen any evidence here in Tennessee?
Yeah, unfortunately, we have gotten some preliminary reports that some labs have suspected that they have picked up on the variant here in Tennessee. What they have done, and is the typical process, they take those specimens that they believe might be the variant and they send them to CDC for confirmation. So we will await to see when the CDC confirms that the variant is here in Tennessee. But I'm telling you right now, I don't need the CDC to tell me that, because whether it's now or 6 weeks from now, that variant will be here. And it would really, really surprise me if we don't already have it, because these things travel so rapidly and people are moving back and forth between states and even between countries still. And so we're going to have the variant here before long. Now, what does that mean? It means that we're going to have a strain of the virus that spreads much more quickly and is easily transmitted. The good news is that it doesn't seem to be more deadly or cause more hospitalization, but if more people get infected and there are more susceptible people that get infected, there will be an increase in hospitalizations and deaths. So related to the vaccine, I have not seen any credible scientific reports that the variant is resistant to the vaccine, which is a really good news. So it does seem to be resistant to, susceptible to the vaccine, and the vaccine can protect you against that. So that's good news as long as we've got plenty of vaccine to go around.
And I believe, based on media reports, that the next vaccine up is apparently Johnson & Johnson, which they are in late trials. Is that correct?
That's my understanding, Steve. I think from what I have read, it looks like Johnson & Johnson may submit their data to the FDA for potential EUA approval in the next 2 to 3 weeks. So that will be coming up pretty soon. And then if you'll remember the process when Pfizer and Moderna submitted their data in late November, early December, it took FDA between 2 to 4 weeks to get that process done. So I suspect most of the month of February will be taken up in that review process of that vaccine candidate. And then we could potentially see an EUA approval of Johnson & Johnson in early to mid-March. Some indication that they've hit a little hiccup in production. And so I don't know how quickly or how much of the J&J vaccine we will see on site here in the month of March, but I'm still hopeful that we will see that product in March and perhaps the AstraZeneca product shortly after.
That is very exciting. Dr. Lisa Piercy is our state health commissioner. Doctor, let me bring the issue of the age of those who can receive the vaccine. We know that in several states they have lowered the age limit. Even the Trump administration had called for the loosening of requirements to get more, as they say, shots in arms. Where is Tennessee on the age? I know the minimum right now, I believe, is 75, if I'm correct. So where are we on that?
Yeah, I'm glad you asked, because that really gives me the opportunity to highlight what we've done in Tennessee here as an evidence-based approach. And, you know, what we're seeing here is not terribly different than what they're seeing nationally, but just as in this whole response, we want to tailor our actions to what is really going on here on the ground in Tennessee. And what we have seen is that well over half of hospitalizations and 80% of deaths are in the 65 plus population. And even when you break the 65 plus population down into 5-year increments, there is a really steep drop off between 75 and 70. Saying that a different way, people age 75 and older have a very high likelihood of being in the hospital when they get sick, and they have a very high likelihood of not coming out of the hospital alive, unfortunately. So when we look at who is the most vulnerable and who is most likely to be hospitalized and die, it is our 75 plus population. And the reason we want to focus on them is not only for their own health outcomes, but you'll particularly remember in the month of December, but it's still going on today, our hospitals are under extraordinary strain. And a lot of our hospitalizations are from that elderly age group. And so it's a dual benefit, not only from the individual health outcomes, but it helps protect and relieve our hospitals a little bit when we focus on that older population. So right now we are in the 75 plus age category, and I'm trying to work my way down to 70 and to 65 as quickly as possible. The fact of the matter is that I've still got about 100,000 people on the waiting list for 75 plus. And what I don't want to happen, and I know this might be a little hard to swallow, but I think you'll understand it. What I don't want is somebody who is 65 and very active and tech savvy and mobile to sort of outsmart an 84-year-old who might depend on others for transportation and might not be very technology literate, because we know statistically that that 84-year-old is going to have a worse outcome. So I really want to focus efforts on 75 plus, and I'm going to move down to 70 plus as soon as I can. There actually are a very small handful of counties, usually our very rural and distressed counties, who have gotten through their 75 plus population and are starting to move to 70, and I'd like to make that statewide very soon.
So you would in fact go to 70 as opposed to what some other states done, 65, and that's because of the situation here in Tennessee.
That's right. And we've looked at our data, and with every 5-year increment, there is lower and lower hospitalizations and death. And I made a point a minute ago that there's a big drop off between 75 and 70. There's also a pretty good drop off between 70 and 65. And so I think particularly if we can focus on 70 plus for a while, then we can really make some good progress in those hospitalization numbers. Let me give you just kind of general population estimates. So we have about 450,000 Tennesseans that are 75 and older. When you go down to 70, you get to about 750,000. And then when you go down to 65, you get up to about 1.1 million. Now you remember, I'm getting 80,000 vaccines a week. And so it really doesn't do me any good to open it up to 1.1 million people right now when I've only got about 80,000 a week. I've still got to prioritize those that are at highest risk. And I know that makes it very difficult. You know, my own parents are in that late 60 range. They probably wouldn't appreciate me saying that, but they're in that range, and I want to get them vaccinated so quickly. But I also know that my 92-year-old grandmother is at much higher risk than my 68-year-old parents, and I'm gonna have to get grandmother done first before I move to my parents. I think of Tennessee just like I think of my own patients and just like I think of my own family, and that's a hard decision because I want my parents to have it quickly, but I also know that there are others at higher risk.
You should have heard what my 71-year-old mother said to me on the way to this interview, Doctor. So we have our families. I think there could have been something in it for you. I don't. Let me just.
Talk later.
Well, I'm sure you've heard that. We're joined by Dr. Lisa Piercy, who's been very kind enough to join us. She's probably the busiest person in the state, one would think, and with this vaccine and this question, and that's what we're spending our time on. That's what you have reached out to us in great numbers when we announced this interview last week. So just a few more questions. One came actually from the area of education, Doctor, and we did get some questions, and I'm going to read this one to you. Quote, just why is the vaccine distribution to educators so different across the state? End quote.
Yeah, that's a very reasonable question. And so that highlights that different counties are in different phases. And that has to do with a couple of different things. One, it has to do with allocation. So each county is allocated numbers of doses based on their population. Well, you've got some counties that are larger, some counties that are smaller, but remember who was very first in line for vaccines? It was healthcare workers. So where you have counties that have large healthcare workforces, mostly your urban counties with hospitals or with large medical centers, they're going to have to get through that population first. Well, when you have some smaller rural counties that may not have a hospital and may not have very many medical facilities, they get through that healthcare workforce population pretty quickly and can start moving on to future phases. The other thing that we see, so they'll get to teachers sooner than others would that have a big healthcare workforce. The other thing that we see, and it's troublesome to me, but I do understand it, is that some counties have a much lower uptake. And that means that's the rate of people that qualify for the vaccine and were offered it and who have said, you know what, I don't want it. In some of our counties, the uptake rate is as low as 30%. And that sounds preposterous because there's so many people in such high demand for vaccine. Most people say, oh my goodness, I would just, do anything I had to do to go get one. But that sentiment is not widely held, particularly in rural areas where there's higher vaccine hesitancy. So in some of our counties, they have essentially been offering it to 75-year-olds and even 70-year-olds for a couple of weeks now, and there's nobody else who wants it. And so they're ready to move to the next phase. Some states have said we're not moving to the next phase until we get finished with the phase we're in. And that approach just doesn't make sense to me. Now, I will agree, having different counties in different phases is messy. And it would be cleaner to keep everybody in the same phase. But you know what that does? It slows it down. And there is nothing that I want to do to artificially slow this down just because it's less messy or it's easier on me. So in those counties, if we're comfortable that we've offered it to the current phase and nobody else wants it or a diminishing number of people want it, we're going to move forward. And that means there are some counties that have had their what we call 1B or teacher K-12 population vaccinated, and we're going to keep right on moving.
We're joined by Dr. Lisa Piercy, again, the Commissioner of Health in Tennessee. And so, let's talk about those people under 65, and let's prognosticate a little bit here. I don't mind telling you, Lisa, I'm 42 years old. You got people in their 30s, their 40s, whatever, they don't have pre-existing conditions. They're not a healthcare worker. So let's just talk to that average person under the age of 65. Do you have any idea, or in your medical opinion and what you're seeing, any idea when we can expect to be able to get the vaccine?
Well, throughout my career, I've always taken the mentality of under promise and over deliver. So I'll tell you that's what I'm about to do. I think it's probably going to be summertime before we can get it out to widespread lower risk folks. And I mentioned earlier my own family. My husband's in that category, and many of my sister, who's an attorney, she's in that category. It's going to be a while, unfortunately. What I hope for is that I'm wrong. I hope I can get there by April or May or June. What that really depends on is how soon we can get additional products on the market. We've already talked about Johnson & Johnson and AstraZeneca being numbers 3 and 4 most likely, and how quickly not only the new ones, but our current ones of Pfizer and Moderna can ramp up production. So I am targeting to be in the 1C population, which is our high-risk medical conditions, probably around April, late March, early April. And then fast forward another quarter, we're looking at probably summertime for most folks.
Dr. Anthony Fauci has said that if the vaccinations go well, and we know the incoming president is aiming for 1 million a day, that he has stated that if the vaccinations go well, Dr. Fauci has said maybe a return to normalcy mid fall, mid to late fall. Do you share that sentiment with Dr. Fauci for Tennessee?
I do, and I sure hope that's true. I just had a conversation over the weekend with my college student, and she's a first year in college, and needless to say, her first year in college has been anything close to normal. It's nothing as she expected. And you know, there's some grief and sadness that goes along with that. And she said, Mom, do you think it will be back to normal in the fall? And I said, baby girl, I really do. I really do think we will be pretty close to normal. And so her first question when I said that, she said, so no masks? And I said, well, I don't know about that. I do think there will be some element of masking that will stay for a while, and probably until we figure out definitively from a scientific standpoint if you can transmit the virus if you're already immune. So we know that happens with other disease processes. What we're not so sure about is with this one. So until the majority of people are vaccinated or naturally immune, masks are probably going to hang around for a while, but I do really sincerely hope and do believe that we're going to have a pretty normal fall.
And available research about, in your estimation, how long the vaccine will immunize a person?
Well, what I can tell you is that it is longer now than we initially thought. And so I'll tell you, initially we thought maybe you were going to have to get a vaccine every 3 months or so. My goodness, that would be a mess. As a friend of mine says, that'd be a hot mess. And so we don't want to have to do that. But you know, if we have to do it once a year, sort of like we do with the flu shot, that wouldn't surprise me, although I will tell you I'm cautiously optimistic that there's some pretty long-lived immunity with this. We have proven without a doubt that you're immune for 6 to 7 months, either after natural infection or after acquired immunity through immunization. So we know we can make it last 6 to 7 months. What we don't know is how much longer it can last because people haven't been infected that long. And so we have to watch it and see. I would love nothing more than this to be a one and done for the rest of our lives. The science just hasn't caught up to that yet.
Doctor, two final questions. Number one, a new administration in this nation starts tomorrow as we do this interview. What are you expecting? As far as a working relationship, have you had any contact with the new federal health officials, and just what do you think about that as they come in?
Sure. Yeah, I actually have had, I guess, 3 touch points now with the transition team, one of which the governor and I did about a week and a half ago that President-elect Biden himself was scheduled to be on. Turns out he had to got called away at the last minute. But I've had both written and verbal communication with the transition team. And this is a big undertaking. And I think when the new team kind of gets their head around and has access to all of the details, they will see that this is a pretty complex process. So what I don't anticipate is some type of magic solution. And that would be for any administration coming in. That's not specific to the Biden administration, just for anybody. When you get in there and you dig into the details, you really realize, wow, this is kind of a complex problem, and easy and quick solutions are probably not best or will be effective. So I don't know that we'll see anything drastic in the first few days or first few weeks. What we have been told, and I think there are some states that would be interested in this. As you know, some states have struggled with vaccine rollout, and so they do plan to offer some federal vaccination sites. At first, those will be optional. I don't know if they will, if the states have to opt in or opt out. I don't know the details on that yet. So I think you will see some of that. But I'll tell you what I hope they do that the Trump administration did that is probably the most successful thing, and that is let states have flexibility. You've heard me say 2 or 3 times already today, we tailor things to Tennesseans because I think any Tennessean would tell you what they do in New York and what they do in California is not the best always here or most of the time in Tennessee. So we want to be able to do it the Tennessee way. And the Trump administration really allowed states flexibility to do that. They provided us with resources, they provided us with a framework, but they said, here, figure out the details for whatever works for your state. It's my hope and my expectation, frankly, that the Biden administration will continue to allow states that flexibility so we can continue taking care of Tennesseans the best way we know how.
Dr. Lisa Piercy, final question. What do we do till then? What do you tell the people of this state to do until things are back to normal, until the vaccination is widespread? What do you tell people?
Yeah, nobody wants to hear me repeat it again because I've said it ad nauseum since the very beginning, but it really is the same thing. Wear your mask, wash your hands, watch your distance. And we've only got about maybe 2 more months, 2 or 2.5 more months of being indoors. Usually when you get to middle of March or end of March, you can get outside a lot more. That's going to help. But while we're confined indoors, please stay away from crowds. Please stay at home when you don't have to go out. Continuing ordering your takeout from restaurants. Wear your mask, particularly when you're in indoor settings. If you have an option to go to drive-in church or to online church, I encourage you to do that. But whatever you do and however you live your life, try to do it safely.
Dr. Lisa Piercy, thank you very much to you for joining us, and thank you for the hard work that you and the healthcare professionals are doing there. And I understand you're a pediatrician, is that correct?
That's right, and I still see patients, just a few patients a week, enough to keep my doctor skills up, and it's one of my favorite times of the week.
Thank you, absolutely. Thank you for the work that you are doing, Doctor. God bless you, and join us again sometime, would you?
I sure hope so. Thank you.
Thank you. Dr. Lisa Piercy is the State of Tennessee Health Commissioner, and a very important interview today that we have brought you. And so I want to give you a couple of notes here. We're live, first of all, here on Mix 104.1. We're on Talk 101.3 as well. I believe our friends at Fiesta 99.1 are joining us. We're also on Mix TV. What we just talked about was extremely important and very important for public health. It affects every person within the sound of my voice. And so what I would say to you is, if you missed the interview, and I know a lot of you are working right now, you're busy right now, that sort of thing, I would go back. This is why we created Mix TVs, things like this. Go to our website, mymix1041.com, and watch it. That was absolutely a fascinating 30 minutes. And I cannot thank the State Department of Health enough for granting us a half an hour with Dr. Piercy. So we are very grateful to Dr. Piercy for taking her time, and to the staff. She does not do a lot of interviews, I'll go ahead and tell you. I was also just given a note here that for the first time in a long time, Bradley County is under 1,000 active cases of COVID-19. Just getting that information in, that once again, Bradley County is under 1,000 active cases. Now that's a really piece of good news this afternoon. And so we will continue to bring it to you. We will recap this interview on our newscast beginning later this afternoon. Also tomorrow morning, be listening right here to Mix 104.1. And again, let me say this to our audience. If you're just joining us, maybe you're listening on the radio or you're watching right now, and you missed it, that was so informative, so informative. We took a lot of questions in. We had a lot of questions come in. We had to dissect those and to bring those down a little bit. But she answered really everything. And so if you have a question about the vaccine today and the process and the rollout, she answered it. Okay, Dr. Piercy answered those questions. You can go on Mix TV, mymix1041.com and watch it back. All right, thanks again to our producer, Austin Chadwick, did a tremendous job. All of our staff here doing a great job. I'm Steve Hartline. Good day.